We will learn the correct sequence for putting on personal protective equipment. The procedure for putting on and removing PPE should be tailored to the specific type of PPE. We will begin by washing your hands or using alcohol-based hand sanitizer. The next step is to don your gloves. Be sure to extend the glove to cover your wrist. The next thing you should put on is your gown. Be sure to fully cover your torso from neck to knees, arms to end of wrist, and wrap around the back. If you tie the necktie prior to putting on, it might be a little bit easier. Be sure to fasten at the waist. The next step is your mask or respirator. Secure the ties or elastic bands at the middle of head and neck. Start with the lower band. Be sure to fit the flexible band to the nose bridge. Fit snug to face and below chin. Fit check your respirator. Exhale gently, no air should feel escaped. Inhale gently, mask should gently collapse. We are now ready for our goggles or face shield. Place over your face and eyes and adjust to fit. Use safe work practices to protect yourself and limit the spread of contamination. Keep your hands away from your face. Limit surface touched. Change gloves when torn or heavily contaminated. Perform hand hygiene. We will now go over how to safely remove personal protective equipment. We would like to remove this PPE without contaminating your clothing, skin, or mucous membranes with potentially infectious material. Remember, your gown front and sleeves and the outside of gloves are contaminated. If your hands get contaminated during glove or gown removal, immediately wash your hands or use an alcohol-based hand sanitizer. Grasp the gown in the front and pull away from your body so that the ties break, touching outside of gown only with your gloved hands. While removing the gown, fold or roll the gown inside out into a bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Place the gown and gloves into a waste container. Perform hand hygiene. If your gloves do not come off with your gown, using a gloved hand, grasp the palm area of the other gloved hand and peel off your first glove. Hold removed glove in gloved hand. Slide fingers of ungloved hand under remaining glove at wrist and peel off second glove over first glove. Discard gloves in a waste container. When removing goggles or face shield, remember the outside of goggles or face shield are contaminated. If your hands get contaminated during goggle or face shield removal, immediately wash your hands or use an alcohol-based hand sanitizer. Remove goggles or face shield from the back by lifting headband and without touching the front of the goggles or face shield. Remember, the front of your mask or respirator is contaminated. Do not touch it. If your hands get contaminated during mask respirator removal, immediately wash your hands or use an alcohol-based hand sanitizer. Grasp bottom ties or elastics of the mask or respirator, then the ones at the top, and remove without touching the front. Discard in a waste container. Wash hands or use an alcohol-based hand sanitizer immediately after removing all PPE. If at any time during the removal of your personal protective equipment you feel that you have become contaminated, stop what you're doing and wash your hands. If you feel your glasses have become contaminated, wash your glasses. If you feel that an exposure has occurred, immediately stop what you're doing and alert your nursing supervisor.